Now, what about the climate, health, population connection? For a long time, neither the reproductive health nor the climate communities really wanted to connect with one another because both parties felt like the other had lots of unwelcome baggage, right? And it's too easy. It's too easy for this climate population conversation to devolve into a sort of, we need less of them to make it easier for us kind of conversation. The reality is much more complicated, of course. And there is no need for anyone who cares about future emissions and the emerging global middle class that I think Homi talked about yesterday. There's no need for anyone to fixate on what in the past would have been called population control. Population control doesn't work. It's grossly unethical. And it isn't even necessary. Instead, let's think about meeting unmet need. Now, 2 years ago, The Lancet, the medical journal, said there were some 160 million women globally, USAID says it's actually more than 200 million women, who wanted access to modern contraception in order to space or limit their children, but they didn't have it. Now, spacing and limiting is good for the health of the mother, maternal mortality. It's good for the survival rate of other siblings. It's good for families to be able to thrive, and for communities and nations, and ultimately for all of us to lead healthier lives. But 160 million women, at least, have an unmet need for modern contraception right now. This is what I would call a classic market failure. Demand is not being met by supply. Why? What's going on here? Well, remember, no one runs towards these issues. Steady funding in nominal terms means declining funding in real terms. There's stigma and social pressure, certainly, around these issues. There's the patriarchy. Let's not forget that. You know, as we speak this week, by the width of a hair, I guess, the parliament in the Gambia ultimately decided not to re-endorse female genital mutilation after a long debate, as though this was something they really had to think hard about. You know, in our own country, comprehensive sexual education is a lightning rod. The ability of women to control their own fertility is apparently only slightly less dangerous than the literacy of a girl. Your tax dollars are engaged in this fight, I am pleased to say, although insufficiently, in my view. And when tax dollars aren't enough, but the need is still there and even growing, what do organizations like mine do? Well, some of our work is now funded not by your tax dollars or mine, but directly by consumers in the Global South. And we run this activity as a for-profit, tax-paying enterprise under the ownership of PSI. And it's now the second largest source of PSI's revenue, following the US government, but ahead of the Gates Foundation, ahead of the World Bank, ahead of all of our European donors, in fact, of all the rest of our sources of funding. So in that sense, your tax dollars have leveraged a social business that is increasingly self-sustaining and directly accountable to consumers in the Global South, which is what I would call a good development outcome. So again, I thank you. I thank you for that. Meeting unmet need. It's estimated to have the same effect as ending all illegal deforestation in the world. Meeting unmet need would certainly offer a stronger chance of avoiding that additional half a child that has huge out-year implications under the UN's projections. The climate health population conversation, which is overdue, is now starting. You know, the Conference of Parties, the COP meeting in Dubai last year, COP28, the climate summit, featured a health day for the first time. And this will be repeated this November at COP29 in Baku, in Azerbaijan. Climate resiliency and adaptation are very much driving conversations around climate finance. But surely there's a place as well for climate mitigation efforts that start with meeting unmet need for family planning anywhere. In the high resource settings, like in the US, one CDC study estimated that there are 19 million women in America who have unmet need for modern contraception. And we know that high per capita emissions of the average American over a lifetime makes this a wise climate as well as reproductive rights and health investment to close that gap. And in the lower resourced parts of the world, in many parts of the global south, meeting unmet need has a small impact now on emissions because per capita emissions are very low. But we've seen the long-term impact of these trends over time. And future emissions, accelerated by rising rates of urbanization and industrialization, makes meeting unmet need now a very compelling long-term investment in planetary health.